Kurt, thank you so much for being here this morning. Thank you for taking the time. It's a pleasure to have you here.
No, thank you for having me. Yeah, looking forward to it.
I wanted to ask, but actually just asking you if you could please share a little bit about you, who you are, and also what to do.
Okay, so I'm Kurt Eggers, as you just mentioned. I'm working at well, I started working as a speech language therapist. I have a somewhat atypical background. I first studied medicine, then went from medicine. I didn't finish the whole 7-year program in Belgium, but after 5 years, I shifted to speech language and audiology in at the University of Leuven in Ghent, a choice that I am up until today very happy with the shift that I made, and then I worked for a couple of years as a speech language therapist. Started teaching in Antwerp, got more interested in research, doing research. So did my PhD, not directly after my master's. I got quite a bit of clinical expertise by that time. So I was a bit older when I did my PhD, um, which I think I like it because it gives you a different background or some more clinical things you're considering in choosing the path to do a PhD. Which I also did at both Leuven and at Tilburg University in the Netherlands because it was a kind of on the intersection of speech language and psychology. And so I've been working, and I still work at two locations at the moment. My primary work location is here at the University of Ghent, where I teach a couple of courses among stuttering and cluttering courses. I also work partly at Thomas More University College in Antwerp, where I primarily do research and I coordinate a European specialization course. And from time to time, I teach in Finland. I am still teaching in Lebanon, so I'm doing a couple of things together, which I kind of like variation a bit, which makes life and work interesting, I would say.
It sounds like it's very also dynamic because you teach several things and in many places. But it's super interesting because you do exactly you work at the intersection of like research and clinical practice. And my question is, how does that combination shape the way that you understand stuttering?
Okay, yeah. Well, that's actually already linked to what I just said, right? So I worked clinically before I started actually doing research, and what triggered me, and I keep mentioning this at talks, were like twins that I saw in my clinic at that we had at home. Rob and Nick, they were twins, and I would call them the prototypical examples of temperament. So. Rob started stuttering, came into treatment. Nick at that point didn't stutter, but like a year or 2 years later, I kind of forgot. He also started stuttering and came into treatment. So my interest in doing research is really the interest started from a clinical question. I had two kids growing up in a similar environment with the same kind of genetical material, at least part, and you saw that both of them reacted in a fundamentally different way to what happened when they stuttered. And I was like, hey, what's going on here? So that's what triggered my interest in looking at not so much personality, but more temperament related factors. So, and when you say how does that kind of shape your understanding of stuttering? Well, I think everyone nowadays, every specialist would say, well, stuttering is a multifactorial condition where different factors play a fundamental role: genetics, speech motor aspects, linguistics, etc. Um, and we study those, but I'm primarily interested in that one component that's more linked to learning factors. How do kids at a young age, when they start stuttering, Why do certain kids react in a different way than other kids do? Some kids become more quiet, stop talking, are a bit more shy when this happens, turns red. Other kids, they kind of more push out certain sounds. Why does that happen? And that's kind of the aspects that we're studying in the lab. So it's basically at at the start of stuttering when you have a sound that's stuck in your throat or your lips that you feel a little tremor. Why do you react differently? And that's what we're trying to kind of study, and how does that shape the impact that it has on your later life, or the impact that the stuttering has on your day-to-day activities. That's at least one of the initial research lines that we had.
And it's really interesting to see how, from your experience, how these factors influence the experience of like stuttering in kids or maybe in adults also, because indeed every person is different, and every person who like stutters feels in a certain way and they might act in a very different way. So do you think it has to do with temperament, like in terms of, do you think it's like more about the inner self, like the self-confidence that a child has, for instance, even if they were born and raised in the same home with the same like parents? How do you think these factors influence stuttering?
Yeah. Well, and let me start by saying we still do not know many aspects, but on the other hand, we do know quite a few things about how temperament, attentional components play a role. Perhaps very briefly, because quite often when I give talks about temperament, people refer to temperament and think about temperament in these, I would say, old and tainted ways. If we're talking about temperament, it's you could say it's almost how we are programmed from a very young age on to react to external stimuli, but also internal stimuli, right? How fast can a young child become happy? How fast can a young child become upset? If somebody is upset, how long or short does it take to soothe the child? So temperament can be seen in like three components. On one hand, like reactivity, and that can be positive reactivity, or it could be negative reactivity. And I've just given you two examples of that. And on the other hand, you have self-regulation. Are you able, if you are kind of upset, are you able to self-regulate? Um, and when I say are you able to self-regulate, it's kind of like, can you shift your attention to something that is, for instance, taking your mind off certain things that are triggering negative reactions? That's the idea of temperament. And the reason why I also shifted to attentional work was that self-regulatory component of temperament. Can I increase or decrease my reactivity? A big component of the self-regulation of temperament is attention driven, or attention is a big aspect of that. So I just gave you an example. If I'm in a situation that I don't like, or I'll give another example. If I'm a person who stutters and I'm in a moment of stuttering, um, how easy is it for me to focus my attention away from that moment of stuttering, or to focus my attention away from a situation that triggers stuttering, or evokes more stuttering, to a situation that doesn't do that? So can I shift so attentional focusing, shifting are major components of that. So, and what we've been doing, or what we've been trying to do in our lab, is look at what is the role, or what could be the role of temperament in the development of stuttering. And I'll just give you a couple of examples. We've in our lab we use a couple of methodologies. So we use a lot of computer tasks. So when kids come to our lab, usually we say, or quite often we go to the home situation of kids too. They play computer games. So kids that participate in our research afterwards would say, "Oh, we played computer games over there." So, and one of the computer games we used at a certain point was we said to the kids, "Well, you have to play a little game here on the computer." But it's an old computer, and sometimes the computer gets stuck. So you might click and it doesn't work, then click again. But of course, the computer was not old and didn't get stuck. But the paradigm that we used, so kids clicked and sometimes it didn't work. But it was a way of seeing if kids react and it doesn't work, how easily do kids get frustrated, for instance? And frustration tolerance is also a component of temperament. And what we, for instance, there saw was those kids who got more easily frustrated because of the I'm clicking the tab and it's not working here were, and again, these are not individual but group data, were also those kids where if you evaluated their stuttering, had some longer stuttering moments than the kids who were less easily frustrated, or also had some more secondary behaviors. So I'm stuck and I want to do something, get out of that moment of stuttering. I blink with my eyes, I move my head. So the easier a child got frustrated when a certain game they were playing was not functioning, we also saw that we could translate that to their stuttering. So we used these kind of paradigms, computer paradigms. We used parental questionnaires, children's questionnaires. But for instance, what we've recently, together with the people from the Michael Palin and the data set we got from them, kind of found, and that was not in like preschoolers or school age kids, but a bit older, like adolescents. We saw there, for instance, that those adolescents who score higher on negative reactivity, so are more easily frustrated, um, a bit more anxious easily. And again, this is not atypical. These are also people who do not stutter have different variations in these temperamental constellations. But we saw that those kids who were higher in negative reactivity and lower in positive reactivity, that combination, those kids had a higher impact of stutter or reported a higher impact of stuttering on their day-to-day lives. So, for instance, if we asked questions and we have questionnaires for that, asking how does stuttering impact you making friends, going into discussions with people you don't know, and those kind of things. Well, we saw actually that temperament is linked to the impact that stuttering has on a somewhat older age, which is, I would say, highly interesting to know from a clinical perspective.
I mean, we know that everything starts in our childhood. In this aspect, do you think there is something that the parents can do if the parents start teaching a baby, like one, two, three, like since the very beginning, how to deal with like frustration, how to self-regulate? Do you think that would help those kids who will end up stuttering to deal with their stuttering better?
Yeah, that's an interesting question, and let me put it like, let me first say, if you look at very young kids, because temperament is also something that has a high genetical predisposition. So stuttering is something where you have a high genetical component, but also temperament has a high genetical component to it. Now, with regards to can we work on certain of those components, the answer is yes. But if you look at the development of temperament, it's linked to the development of a child. When a baby is very young, newly borns, they only have like negative reactivity. They cry when they're hungry, when their nappy needs changing. When they're a bit older, a couple of months, then they start laughing, and then it's when mom and dad are very happy because hey, he or she starts smiling. So positive reactivity evolves a bit later in childhood development than negative reactivity. And then self-regulatory behaviors um, still develop a bit later on. So it's at the age when, for instance, when a child is lying in a cot and they put these mobiles over the head of the child, and literally what they do is a child starts crying, and what mom and dad would do is they would turn the mobile on, would put the music on, and what are they actually doing? A child shows negative reactivity, crying, and they try to help the child regulate that reactivity because they shift his attention from what's happening to, hey, there's something nice turning around, or it has music. So it's attentional shifting. But if you would hang this mobile at the age of, let's say, a couple of weeks, it would have zero effect because self-regulation is something that develops later on in life. Now, self-regulation is something that is not the development does not stop at the age of 5 or 6 or even 10. So self-regulatory behaviors, they keep on developing. Of course, there's a big developmental phase um, um, in the early ages, but it continues, I would say, up until 18, 19, 20 years of age. So with regards to can we do something before the onset of stuttering? Well, I don't have a straightforward answer to that, but can we work on self-regulatory behaviors in, for instance, young kids who start stuttering? I would say definitely yes. And some of the advices that we're giving based on our research with regards to temperament is well, you can work on those self-regulatory behaviors, absolutely. And if you look at certain treatment programs for which you have already quite a bit of evidence, think of programs like the parent-child interaction approach. It's if you look at what they're doing there, they're actually teaching their kid, teaching parents to deal with what happens if a child is in an environment where that triggers more stuttering. How can you regulate, co-regulate with the child that specific environment? What kind of things can you do with your child too? So they're working on self-regulatory behaviors. Another program, if you look at Restart DCM, um, it's another program widely used in the Netherlands, but also at other locations. They would also work on self-regulatory behaviors. And I would say if you would look at the old versions of the program, they wouldn't necessarily be talking about temperament. But if you look at the updated versions now, or the more recent versions of the program, they would all list, hey, this is working on temperament that we're actually doing. One more example, which is a thing that's also being done not just with younger and older kids, but also with adults, adolescents. Um, if somebody stutters and goes to a therapist, sometimes it could be that they're using what we call pseudo stuttering or desensitization exercises to react less um, emotional when you have a moment of stuttering. So sometimes they would ask in certain situations, in certain contexts, to deliberately make moments of stuttering. And what you see, it's similar to if you're afraid of spiders, when you see a spider, you're going to become anxious and your heart is going to pound and you're going to react in a certain way. Same thing with stuttering. If this happens or if I'm totally blocked, younger kids, but even older and adolescents, would react emotionally to it and would develop gradually these secondary behaviors. If you're able to react less emotionally to those moments of stuttering or stuttering triggering situations, um, then secondary behaviors will be less likely to develop. So that also means if you can desensitize a person to moments of stuttering, that has a beneficial effect. And that's what quite a few clinicians would do. But if you think of what's actually being done there, you could say it's kind of decreasing the reactivity or increasing self-regulatory behaviors. I'm not going to go into is it one or the other. It's most likely a combination of both. But it's linked to that temperament work, I would say.
I know that you have worked with a variety of groups, including bilingual speakers. What has that taught you about stuttering?
Yeah. Um, yeah, so one of our research lines is that we look at uh, not just stuttering, but also speech disfluencies in bilingual kids or in specific populations like autism, children with Down syndrome, etc. And I would say that the bilingual population is a very interesting, at least for us, a very interesting population to study. Why? Um, well, if you look at some of the papers that were published, I would say 15, 20 years ago, they would say, and that's also how I was trained as a speech language therapist. I was literally taught that if you have a young child that stutters and it's confronted with, or it grows up with two languages, bilingual child, it might be better. And again, I'm saying it with the necessary caution, but at that point, the idea was it might be better to shift to one language because the combination of two languages might be linguistically kind of a bit overpowering for that kid and might put a bit more stress on the speech language production system. So you do find some papers from quite a few years ago saying, is stuttering possibly more prevalent in bilingual children? Is bilingualism a risk factor if a child stutters, or is it a risk factor to start stuttering? And that triggered my interest. Is that really the case? So I was lucky. One of my doctoral students, and currently she's working as a postdoc with us here, Selma Saad. She's from Lebanon, where everyone is growing up in a bilingual way. And the bottom line is, if bilingualism would trigger or would be a risk factor, you would expect in countries where kids are growing up and all speak bilingual or all are bilingual, that in those countries the prevalence of stuttering would also be consistently or substantially higher. And again, those kind of studies have not really been done. One or two studies, but they have some methodological flaws into them, I would say, and some colleagues have pointed them out too. So what we've started doing is looked at different language diets. So we've looked, for instance, at Yiddish, Dutch speaking kids, French, Dutch speaking kids, but even Japanese, English, Japanese, French, Turkish, Dutch, Turkish, English. So we've looked at different language diets. And what we first tried to study is we took speech samples and looked at how many disfluencies do we produce, because it's we all produce disfluencies. It's not Disfluencies are not a typical characteristic of a person who stutters. We all make disfluencies. The difference is a person who stutters makes a bit more disfluencies and more of a certain type of disfluencies. When I do this kind of phrase repetition or filled pause or a pause, these are disfluencies we all make very frequently, and we call them typical disfluencies. But if this happens, right, if I'm blocked here, again, this might sometimes happen, not as long as I did now, but also people who do not stutter might sometimes have these what we would call atypical disfluencies in a very infrequent manner. But if they surpass a certain threshold, then people say, I, this is not in line with the norm, or I feel that I do this much more, or it is becoming a problem. Again, not all people who stutter have a problem, but so there's a difference between typical and atypical disfluencies. When we were studying these bilingual groups, what we saw was that bilinguals actually make more disfluencies than monolingual kids. And we've looked at many language samples, and that's something that I was going to say, have seen consistently. We haven't seen it consistently. We also have some speech samples and some data sets where we don't see it. But I would say in the majority, we do actually see that bilinguals have more disfluencies. And also some of the disfluencies that we used to label from a stuttering perspective as, hey, these are indicative of stuttering. So, like part word repetitions, for instance, like when I would be doing this, um, a person who's specialized in stuttering would say, "Oh, yep, I've noticed moments of stuttering, for instance." But you also see these type of disfluencies in a higher prevalence in bilingual children. So that basically means, and that's an important, also in bilingual children who do not stutter, right? So it's important to kind of realize that because if we're using like monolingual guidelines or monolingual criteria uh, in a bilingual population, we're going to end up with a lot of false positive diagnoses that we say, oh, this is a child that stutters, whereas there's no parental worry at all. The child does not react at all. Well, in that case, there is no stuttering at all. So for us looking at a bilingual population, it's an intriguing population because it's a population that has more disfluencies, and we're now trying to um, unravel why is that the case. So I have one doctoral student here, Gizem Aslan, who's looking into executive functions, who's looking into attentional functions in bilinguals and monolinguals and see might those factors be driving the increased frequency of speech disfluencies, for instance. Is that related, yes or no? We do see, for instance, quite often that if you use your non-dominant language, so quite often, if you're speaking more than one language, your one language is dominant. You speak more. You have more proficiency in the language. I'm kind of putting a couple of terms together for simplicity reasons. But if you're speaking your dominant language, quite often you have a bit less disfluencies in the dominant and a bit more disfluencies in the language that in the non-dominant or the language that you don't speak that often or a bit less familiar with. Again, what we're looking at the moment, do language types, language groups, do they play a role in the frequency of disfluencies? So I started by saying there are quite a few things that we still need to unravel in this area, but that makes it intriguing, I would say, right?
Well, it's fascinating and it's very intriguing indeed. Because I have heard some parents they are concerned, for instance, that their kids take longer to start talking because they are learning two languages at the same time.
I would say important to realize that um, in bilingual kids, as in monolingual kids, of course, you have children where language develops a bit faster and in others where language development is a bit slower. But what we know from research purely into bilingualism and my interest or our way of looking at bilinguals is primarily from the disfluency point of view and the stuttering point of view. But we know from bilingual research that it's not that atypical that you can have some kids who are being raised in two languages that sometimes you have a somewhat longer, like a silent period, but that doesn't necessarily mean that their language is delayed or disordered. It could well be that it takes them a bit longer before at certain stages, but then when they start talking, that all of a sudden people are surprised about how fast they are picking up certain things. So it's not that sometimes or certain stages take a bit longer, that there is a delay or disorder. And that's an important distinction that needs to be made. The only thing is, and that goes with stuttering as it goes with language issues, if you have a child that grows up and is being raised bilingually, as a speech language therapist, and if a mom or dad knocks on your door, you have to be very careful to use monolingual guidelines to evaluate the language of the child and then say, oh, there's a delay or whatever. So you cannot use the monolingual guidelines to evaluate the language development of a child. You have to look at the perspective from it's a child that is growing up bilingually. The same thing about stuttering. Oh, just one second here. Oh yeah. So you cannot use monolingual stuttering guidelines or monolingual stuttering criteria in bilingual children that are growing up. At the moment, because I didn't say that earlier on when you asked the question, but at the moment, I would say, based on the data we have so far, based on the data we have so far, there is no evidence that suggests that bilingual children are are at a higher likelihood of developing stuttering. There are a couple of studies that are hinting towards that, but based on our own research, we assume that that comes because, well, they show more disfluencies, but that is not necessarily stuttering. It's similar to if you take a language test with a child that grows up using two languages, you should be a bit hesitant in using a language test just in one language and then using a monolingual guidelines to interpret that. It's kind of the same problem there. Yeah.
Parents, they feel unsure about what to do when a child starts stuttering. So, what do you think matters the most in those early stages? And what advice would you give to these parents?
I would say my gut feeling or my basic advice would be if parents are worried, go to a speech language therapist that's specialized in the area of stuttering, right? I think most speech language therapists in their basic education have some good courses here in Belgium, the Netherlands, about stuttering and cluttering, which is not the case for us in the US necessarily. But here in Europe, I would say that is the case. But still, you have some speech language therapists who are a bit more specialized. So I would say if you're worried about the speech disfluencies, is it stuttering question mark of your child, go to a specialized speech language therapist who will evaluate the child. Um, Not every child that ends up in the clinic or in the private practice of a speech language therapist where parents are worried, not every child will be listed or will be evaluated and the therapist will say, oh, this is clearly stuttering. In quite a few cases, it's not stuttering. It doesn't point to stuttering. But if parents are really worried, I would say go to the speech language therapist, have the evaluation, and that specialist will be able to kind of pinpoint are these typical disfluencies or more atypical disfluencies? Does the child make secondary behaviors? Yes, no. They will ask questions about is there like family predisposition towards stuttering? So it's not just evaluating the child, but it's also getting some information about the family. How does he react? Did he talk more earlier on and did he stop? Is he now talking less in certain situations? So you will get some, or he or she will ask some more information about how did the speaking part gradually develop. Based on that, that therapist will say, yes, this is stuttering or this is not stuttering. Even if they say it's stuttering at a very young age, quite often the SLP would not necessarily say, oh, we have to start working on it. Um, because we know from research that kids that start to stutter at a young age, there's a high likelihood that in many of those kids, after several months, they're not stuttering anymore, right? And 20, 30 years ago, it was like looking at a glass ball and kind of how do we predict which kids where the stuttering will kind of disappear or in which kids it doesn't. Nowadays, we have at least some factors. We don't have the Holy Grail. We cannot predict with 100% certainty, but we have some factors that we evaluate and that we look at to see how high is the likelihood that the stuttering will continue, yes or no. If the likelihood is more that the stuttering is going to go away, then usually a therapist would say, let's follow up the child for some time. So not they would not send the parent back home, but what they would enter a phase of what we would call active monitoring. And this could be that the therapist or the stutter therapist contacts the parents every 2 or 3 months or asks the parents, give me a call back in 3 months and see how it has evolved. Some would do it on a more regular basis. Um, so if you go to a therapist, it would be very odd that all therapists would then start therapy with all kids. They would have this active monitoring phase. If the stuttering is not going down, then they might start treatment, and that can happen at a young age, absolutely. So if parents are worried, go to a specialist. What can you do at this point in time? Don't try to correct your child. Don't try to give well-meant advice. I haven't seen a parent that let me put it like this: every parent wants to help his or her child, right? This is this is basic evidence, very evident. So, a parent wants to help the child, and quite often they think, well, can I help by saying slow down or um, say it a bit slower, start over again, breathe in. We know that all of these advices are not really helpful for most of the kids. So, the advice we usually give to parents, just keep on making eye contact. If a child is really stuttering and has a hard block, you could easily say to a child, "Oh, I noticed that you got stuck there. No worries. I keep on listening to you. So keep on making eye contact. Keep listening to the child. Don't try to correct it." That's I would say, plan A advice. Plan B advice, go to the therapist, and he will follow up and give you some more detailed advices. And this goes both for parents of monolingual as well as parents of bilingual children. But what we've seen in clinics quite often is if parents are really worried, quite often there's something going on, right? So it's good that you go to a therapist. And if I am worried, I am also going to react in a certain way to the disfluencies that my child is producing. So I think we also should be aware of the fact that when I was saying earlier on, when a child stutters, temperament is kind of driving how you react to your moments of stuttering. If I'm a dad, and I am a dad of not a child who stutters, he's not a young child anymore. He's in his 20s. But if he would have started stuttering, and I'm very worried, of course, I'm going to react in a way that I think might help him. But he will notice the worry on my face. He will notice when I say to his mom, "Oh, have you seen it?" So kids pick up on these things. Kids pick up on worry of parents. So therefore, it's important to go to a therapist that can give you advice in what to do, what not to do.
Yeah, definitely. It's super important to have the right person, the right speech therapist. And it's not always so easy also because there are not so many speech therapists that are specialized in like stuttering from what I have seen. So I think for people who stutter and for the parents of the kids who stutter might be sometimes a little bit challenging. Um, and that's is something actually on your on the website. If you want to also mention a bit how people who are in Belgium can find the right speech therapies for people who stutter, it's really useful.
Yeah. Um, well, I would say there are a couple of organizations in Belgium. If you're looking for a speech language therapist who's specialized in stuttering, that you can contact or consult. Um, you have uh, the Belgian Federation of Speech Language Therapists. So the Vlaamse Vereniging voor Vlaamse Vereniging voor Logopedisten. So it's vvl.be. That's not an organization for stutter therapists, but it's an organization of speech language therapists. And on their website, usually you can tick who is specialized in stuttering, and you get some information on that. But then there's also websites of organizations that specifically have trained or working in the training of the continued professional development of speech language therapists. And I'm involved in two of them. So we have a European specialization training that we've been running, I would say almost, no, it's not 20 years, but I think it's 18 years or something like that, that we've been running that organization. And so we have speech language therapists from across Europe. And I would nowadays it's actually globally that participate in that training program. So I can give you the websites or the links to those websites. It's Stuttering Specialization dot EU, and then you have a second website, Certified European Stuttering Specialists dot EU, I think it is, but I'll give you the websites. It's These are two organizations. One is the organizations that trains people, SLPs, to become stutter therapists in Europe, and the second organization is more of a quality assurance organization to say, well, people who are registered with that organization, they document on a yearly or every couple of years their continued professional development, their clinical work, etc. But there are a couple of organizations where people can consult with.
Thank you. No, that's super useful for sure, to make sure that people can find the right person, the right professional for them. And I would like to know what type of research are you currently conducting at Ghent Stuttering Research Group?
Yeah, okay. Well, we have here in Ghent with the Stuttering Research Group. We're a group of five, six, seven people working together on different research lines, and we've mentioned a couple of them. One of the research lines is on temperament. We have a specific research line on attention, executive functions. How do those components kind of influence, impact speech disfluencies? We have one research line that is more into typical or specific populations, like children with Down syndrome, autism, bilingual populations. We're looking into. We're also evaluating certain treatment programs. So as we have a couple of doctoral students working on different aspects, or so they work on different research lines. But I would say again, have a look at our website. I will also give that website srg.ugent.be, where you can have lots of information about the research that we're currently doing, and we're always in search of people who are interested, and parents who want to help us, parents of kids who stutter, adults, adolescents who stutter, who want to help us in doing that research, because the ultimate goal, of course, of doing the research is working towards better treatment programs, helping people who stutter.
And I also wanted to ask you, as we're talking about research and like stuttering, looking to the future, what developments in stuttering research or therapy give you the most hope and why?
Hmm, yeah, that- that's a I would not necessarily say a difficult question to answer, but it's a bit of a tricky question to answer. I'll explain what I mean by that. So there's um, from a treatment perspective, I could say that the last couple of years, last decade, some new developments have been going on in the world of stuttering therapy. Things like, can we use virtual reality in our treatments? So that's, for instance, a domain that's kind of booming, and we have one doctoral student who is also working on, at least partly working on that here. Um, there's some research, and perhaps first with regards to virtual reality, and we actually have a Ghent company that is working on VR equipment for stuttering treatments. But using virtual reality is, we talked earlier about desensitizing people to their own moments of stuttering, but also, for instance, desensitizing people towards talking in front of groups, for instance. And you can see that if you have a virtual reality environment where you have a couple of people, not real people, but looking at you while you're doing work at a speech language therapist's office, that can kind of help to go from doing a presentation in front of your one person or in front of your speech language therapist versus doing it in front of a wider audience. So Yes, virtual reality is I would say booming a bit at the moment. There are some other approaches like using transcranial magnetic stimulation and at certain parts of the brain, and how does that impact stuttering? If you would ask me, so those are kind of new developments that many people are doing research in. If you're asking me what is for me a thrilling development on a worldwide perspective, if you look at what people are doing at the level of treating or working with people who stutter, you could say there are two big domains or two big approaches. You have more what we would call stuttering modification approaches. What can we do to help a person who stutters to, if he's stuck, to get out of that moment of stuttering, but also to desensitize a person who stutters, work with his cognitions, emotions. You have also fluency shaping approaches, which focus much more on how can we teach a client to stutter without stuttering. Um, and there was a lot of discussion within those or between those two groups. In Belgium, the Netherlands, I would say there has always been a big emphasis on, hey, it's highly important if you're working with people who stutter, no matter if they're like 25 or 5, to focus on what a person who stutters is feeling, what he's thinking, what's going on in that head, and that's kind of driving his reactions too. So we here in the Belgium, the Netherlands, we've always put quite a bit of emphasis on that, and not necessarily the most emphasis on the speech motor component. What we see nowadays on a worldwide scale is that the focus on, hey, it's important to focus on what a person is thinking, what he's feeling, his cognitions, his emotions is gaining more and more momentum. And to me, that is highly important that we kind of move away, not necessarily in all cases, but that the focus should not necessarily be only on this
On the
component,
speech.
but the whole person who is sitting in front of you. And again, I think here in Belgium, because of some um, good, let me call them grandfathers who taught us how to do it. Um, we have been doing that for years, but you see, that's a momentum that's taking place worldwide at this point in time. I think that's good. That's one thing. A second brief thing, I think it's also good that more and more speech language therapists say, well, working with stuttering, it's important, but it's also important to become specialized in that area. So, and that is not just the case for stuttering, but also for other speech language domains. So you see more and more people who want to work with kids, clients who stutter, that they follow additional training courses. And again, I think it's good that we have highly specialized speech language therapists working with or working in the field with not just the basic 3, 4, or 5 years education, but additional continued professional development that is focusing on those new approaches, etc. To me, that's those two components, focusing on the whole person, not just on one component. Um, Being very well trained in working with stuttering, to me, those they might not be the most sexy things to name, but to me, I think those are highly important for the clinical field at least.
It's interesting that you point that out about treating the whole person, not just the speech. I have encountered like speech therapists that said exactly that they are specializing in like stuttering. And they mentioned that they also ask sometimes the patient or the client, what do you want to work on? Do you want to work on fluency? Do you want to work on how to handle the emotions of handling stuttering? What, like, why are you here? What do you want to work on? So trying to really understand, because some people might not want necessarily to work on the fluency. Maybe they just want to work on, okay, how can I better handle stuttering, right? So it's so important to really understand. And some people just want to improve the fluency. They want to learn
Yeah.
like better ways to talk, to speak, and that's also super valid, but I think it is indeed important to understand what the person wants.
Yeah, I think you put your finger on the most important aspect there. It's what we call in the clinical field the joint clinical decision-making process, right? I think we've moved and well, perhaps I should have mentioned that also into the important developments over the last couple of years. I think we've moved from a situation where a therapist was saying, "This is what I will teach you," or that I will work with you on, and if we do this, then you'll improve. Or from that perspective to, okay, I have 10 different clients sitting in front of me. These 10 different clients might all want something totally different. Finding out what can I help you with? What can I do for you? Um, the answer that client A might give might be totally different than client B. Now, of course, in order for them to give a real answer what they really want, they have to be well informed. So I think it's our task as stutter specialists to inform what we can work on with them. What are the consequences of working on certain components? What are the benefits? What are the pitfalls? Um, and then come up with a joint clinical decision making process. But listening to your client, what does the client want? And it could well be that I, as a therapist, think, with this client, it's highly important to work on what he's thinking, what he's feeling. But if a client wants certain techniques to help him at certain occasions, well, that's what I would do. But I might also say, well, can we also focus on the other components later on in treatment, for instance? So, but that's not, I am not saying this is how to do it. This is kind of what you decide together with the client sitting in front of you. Different people want different things or expect different things from treatment. And more research is actually also saying that if there's some nice research coming out where they've sent questionnaires to adolescents, adults who stutter, what do you expect from treatment? What do you want to work on? And you see that that is a diverse pattern, right? So that's an important factor to take into consideration.
Yeah, definitely. It's super important, I think, too. You have mentioned stuttering and also cluttering. Many
Mhm.
people might not know what is cluttering. Could you briefly just shed some light, just share what is the difference between stuttering and cluttering for those who don't know?
Yeah. Oh, yeah, that's funny. We didn't mention that either, but I have a new doctoral student who only recently, well, he's bound to start in 2 weeks, and he will work on both stuttering and cluttering. He's from Italy. So also cluttering is a condition that's linked to some issues with regards to speech fluency, speech disfluencies, but it is different from stuttering. They do co-occur quite often together, right? But it's not the same condition. So what you see with people who clutter, you see that there's uh, sometimes they talk very fast and then they can talk very slow again. So there's this what we call rapid spurts from time to time. So um, initially, when they start talking, you might say, "Oh, I don't notice anything," but then from time to time they wander off and then jump into something that they speak very fast about. So the variation between sometimes very slow or typical way of talking at a typical pace, but then going into a much faster way of talking. So that's one of the components. Another component of cluttering is that you see more disfluencies, but not the disfluencies that you would typically see in stuttering, like the repetitions or the prolongations or the blocks, but the disfluencies that we, as I said earlier on, that we all make, the filled pauses, the phrase repetitions, but at a much higher frequency. So you see more disfluencies, but different ones from stuttering. Quite often, what also is part of the symptomatology of cluttering is in at least in certain clients the impaired intelligibility because it's a combination of those moments when they talk very fast and sometimes push certain words together. We call it telescoping. For instance, when I would say telescoping, I might make it into techoping. So I delete certain syllables, rhododendron, rhododendron. When they talk very fast, deleting certain syllables, reducing the intelligibility. So that's another component. So abnormally fast or irregular rate of speech is one component. More disfluencies than you would expect. Impaired intelligibility is something that you often see. There are some other factors that you could also see, some aspects related to attention, aspects related to language, but those three ones that I mentioned earlier on, those are what I would say are the most important ones in cluttering. Cluttering is something that 10, 20 years ago, they would say, well, a person who stutters is quite often highly aware. Most people who stutter are highly aware of their stuttering if they're stuttering for a longer period of time. Um, People who clutter are not aware of their cluttering. Again, those insights I think have to be a bit more fine-tuned and have been more fine-tuned over the last couple of years. We see that also people who clutter are aware of their that something is different in the way they speak, but they're not necessarily aware of what is actually going on. But there is also an awareness in them. And again, treatment-wise, they can also go to a stutter therapist. We use the term stutter therapist as an overarching term. So also people who clutter could go to a stutter therapist. But the treatment perspective and what you would do in treatment, I would say is fundamentally different from what you would do with people who stutter. But again, the idea of joint clinical decision making, that is as important in that group too, of course.
Thank you so, so much for this wonderful conversation. I think it's so valid, and I want to thank you also for all of your efforts in your research about stuttering. Uh, I think the more people we have doing research and helping people who, like stutter, and also helping other clinicians, right? To better understand stuttering, it's so important. And I think through this conversation, many people will start understanding better what is like stuttering, cluttering, and for the parents of kids, especially who are going through this and maybe they don't know what to do. It's so fundamental to have this kind of conversations. Thank you so much.
Yeah, and to me, that's one of the most important bits. What I see is because I've worked both with parents of kids who stutter, parents of kids with language issues, parents of kids with dyslexia at my earlier years of working as a clinician. What I always saw was that parents of kids who stutter, the impact, or at least what they're thinking of, what would be going on with my child when he's 15, 16, 20. Um, the emotional impact on parents of kids who stutter is something that drove me through this domain, and it's a domain that we can, I think, really can help parents with. So that's the reason why I'm still extremely happy being able to do the work that I'm doing together with a whole bunch of very motivated doctoral students and co-workers. So, and thank you for giving me the possibility to discuss that with you here.
No, thank you. Thank you so, so much.
You're welcome.
I'm super happy. I really believe that we need to talk more about stuttering. My mom didn't realize I stutter until I was a young adult. So you can imagine
Yep.
like all the challenges growing up, thinking, believing that everyone could realize that I stutter. Like I thought it was pretty clear, pretty obvious, but in her mind it wasn't. So um, sometimes we assume that someone knows and we assume that someone would be able to identify, but if they don't know what is stuttering, because later on she told me, like, I thought the stuttering was a very severe repetition of syllables. And that's what she thought about
Yeah,
stuttering.
exactly. Yeah.
Exactly, because
Was
that's
much.
what they show in the media, right? On TV. That's what they show, the very severe cases of stuttering. So there's not much knowledge and awareness, and many kids and teenagers and young adults pay the price for that in a way, because then they don't have treatment, early on when maybe it could have been super helpful. But anyway, so thank you again so much for the interview. It was a pleasure to talk to you, to learn from you, and I really hope that everything that you shared here today is going to impact positively many other people who need to learn more about like this fluency and who might need support.
To have done so. So looking forward to the end product.
Thank you.
Bye,
So thank you
Rehani.
so much. Bye
Have a
bye.
great day
Have a good
and great
day.
weekend.
Thank
Bye.
you. Bye bye.